All right, let's talk about a drug that if you're in anesthesia, you probably know and maybe even love. Dexmedetomidine. Yeah, we all call it Dex. And look, it's so much more than just another sedative. It's really become this incredible Swiss Army knife-type tool for us because it has this mix of effects you just can't get from any other single agent.
So that's the big question, right? What is it about Dex that makes it so incredibly versatile? How can one single drug give you sedation, pain relief, and blunt the stress response, all while the patient can still wake up and talk to you? That's what we're going to break down right now.
Here's a quick look at our game plan. We'll start with the basics, then get into that special sedation it gives. We'll cover its triple threat effects, see how it plays out in the real world, talk about managing the side effects, and then peek into the future of where Dexem is headed.
Okay, let's dive right in. To really get a handle on dexmedetomidine, you have to start with what's going on at the molecular level.
So chemically, it's the S enantiomer of medetomidine. But what really matters to us clinically is that it's a highly selective alpha-2 adrenergic receptor agonist. That selectivity, that's the secret sauce. It's behind everything that makes this drug so unique.
And when I say selective, I mean really selective. We're talking 8 to 10 times more selective for that alpha-2 receptor than its older relative, clonidine. It's this precision targeting that really unlocks all of its special clinical effects and just puts it in a class of its own.
So what does all that selectivity get you in practice? Well, it creates the drug's most famous feature, a totally different kind of sedation than what we're used to.
And that brings us to this idea of cooperative sedation. Unlike the deep out-for-the-count sedation from other drugs, with Dex, your patient is calm, but you can easily rouse them. They can follow commands, they can communicate. This is an absolute game changer for stuff like awake craniotomies.
So how does it pull this off? The magic is all happening in the locus coeruleus. That's the main hub for norepinephrine in the brain. Dexedra works by quieting down the neurons right there, basically tapping into the body's own natural sleep pathway. The result is a state that looks and feels a lot like real non-REM sleep. It's pretty cool.
But here's the thing, if you're just thinking of Dex as a sedative, you're only seeing 1/3 of the picture. Its real value, the reason we reach for it so often, is that it does 3 key things all at once.
This is what we mean by a triple threat. You get that amazing cooperative sedation we just talked about, you get some real analgesia which helps us cut back on opioids, and on top of all that, you get sympatholysis. It calms down the sympathetic nervous system, blunting that whole stress response. This 3-in-1 package is what makes it such a powerhouse.
Okay, that all sounds fantastic on paper, but how does it actually stack up in the OR or the ICU? Let's take a look at the evidence.
The classic matchup, of course, is Dex versus our old friend propofol. They work in completely different ways, right? Dex hits those alpha-2 receptors, giving you the extra analgesic and sympatholytic benefits. Propofol, on the other hand, is a pure sedative hypnotic.
So check this out. A 2014 study by Wanat and colleagues put them head-to-head in post-cardiac surgery patients. The results were pretty amazing. The Dex group got off the ventilator more than 5 hours sooner. That's a statistically significant difference, and it has huge implications for patient recovery and, just freeing up ICU resources.
And its usefulness isn't just in cardiac surgery. This is a perfect example of its versatility in a really tricky area, pediatric sedation. Here we have a case where a single loading dose was enough to keep a 5-year-old still for radiotherapy in almost all of their sessions. It gave great sedation without compromising their breathing, which is just critical in kids.
Of course, there's no free lunch in medicine. With a drug this powerful, you've got to know the downsides. To use Dex safely, you absolutely have to understand its side effects, and they're pretty much all about hemodynamics.
So if you give a loading dose, you'll see this classic 2-phase response. First, you get a little spike in blood pressure. That's from the drug hitting peripheral alpha-2b receptors in the blood vessels. But that's short-lived. It's quickly followed by the main effect, a sustained drop in both blood pressure and heart rate as that central sympatholytic action kicks in.
And you can see that effect crystal clear right here in these graphs from that pediatric case. On the left, you see a nice, steady, dose-dependent drop in heart rate. And on the right, same story for the mean arterial pressure. This bradycardia and hypotension, it's the signature of dexmedetomidine. You have to expect it and be ready for it. So, to sum it up, hypotension and bradycardia are by far the main things you're going to see. That little bump in hypertension, that's really only a thing if you slam in the loading dose. The good news is you can manage all of this pretty easily. Just run the infusion slower, or maybe even skip the loading dose entirely. That can make a huge difference.
Okay, last section. Let's look to the future. Dexa isn't just a drug we figured out and put on a shelf. People are constantly finding new and really exciting ways to use it.
One of the hottest areas right now is preventing ICU delirium. The huge SED-CALM trial compared Dex to midazolam, and wow, the results were a big deal. Delirium rates dropped from almost 77% with midazolam down to 54% with Dex. This strongly suggests Dex might actually be protective against delirium, not just another sedative.
The story of this drug has just been one of constant growth. I mean, it got approved back in '99 for one thing, and since then, its off-label use has just exploded. And now, we're even looking at totally new ways to deliver it, like this BXCL501 sublingual film. That's taking Dex way outside the operating room to treat things like acute agitation. The story is definitely not over.
But with all this promise, all this excitement, a recent finding from some lab research makes us have to stop and ask a pretty tough question. Is it possible there's a downside to Dex that we're just now starting to see?
Yeah, this was a shocker. A 2018 study using rodent models found that, in the context of surgical stress, doses of Dex similar to what we use in humans actually seem to promote the growth of secondary tumors in models of breast, lung, and colon cancer.
Okay, so let's be real. This is concerning. You can't just ignore a finding like that. But, and this is the big but, we have to remember these were rodent studies. As Dr. Sung-Hen Lee points out in his 2019 review, what happens in mice doesn't always happen in people. So what does it mean? It means we absolutely need more clinical studies to figure out if there's any real risk to our patients. It's just a powerful reminder, right? That even with a drug we use every day, our understanding is always evolving.